Over the last 5 weeks, I've walked you through peptides, one category at a time: healing, weight loss, energy, brain health, growth hormone. But here's what I haven't shown you yet, is actually how they all work together. Because in my clinical practice, peptides rarely are used alone. They're combined, stacked, and based on what a patient actually needs. And the combinations matter as much as the individual peptides. Today, I'm going to show you the most common peptides I use in my practice, how I combine them, and why certain stacks produce better results than any single peptide on its own. I'm Dr. Myra Reed, a functional and internal medicine specialist with over 35 years of experience. I practice early detection longevity medicine. I help people find what others miss before symptoms become diseases. Everything I do runs from my 4 pillars: hormones, gut, lifestyle, environment. My focus is on helping you to live smarter, stronger, longer. Now, before I get into this, there are additional peptides being studied and used in clinical settings beyond what I'm going to cover today. So we're just going to touch on the most common ones that I'm using in my practice right now. This isn't an exhaustive list. It's the foundation of what we're starting with, and the combinations also that I've seen produce the most consistent results. Let's start with what I call first responders. These are the peptides I reach for when a patient has tissue damage, chronic pain, joint issues, or inflammation that isn't resolving. BPC 157 is called body protection compound. We covered that in detail in week 2. It's connected to the gastric proteins naturally produced in our gut, and these proteins will diminish as we age. It acts locally to support the healing of tendons, ligaments, muscles, and the gut lining. Remember Sarah's story? We were talking about how I started her on that BPC 157, and 3 days later she texted me with the words life-changing. Then we're going to get into how we talked about TB 500 related to that thymosin beta 4. This one works more systemically. Where BPC 157 is targeted, the TB 500 is more of a broader result. It promotes cell migration, may help reduce fibrosis, which is scar tissue, and it makes particularly useful for larger injuries, chronic stiffness, and those mobility issues. The GHK-Cu, which Cu means copper, it's a peptide. This is one of the peptides that people are so often surprised to even hear about. It's a powerful regenerator that can help support things like collagen production and tissue remodeling. It's being discussed for both joint support and skin health. So you're getting structural repair across multiple systems at the same time. Now here's where it gets interesting. In my practice, I rarely use these alone. The combination of BPC 157 and the TB 500 together is what some people call the recovery stack. You get the targeted local healing from the BPC 157 and the systemic tissue repair from the TB 500, which work simultaneously together. For patients with chronic injuries like joint pain, post-surgical recovery, this combination can produce results that neither peptide achieves on its own. When you start adding the GHK-Cu, that creates an enhanced version for total body tissue rejuvenation, for like tendons, ligaments, skin, and the connective tissues being supported all at once. The next category we talked about was growth hormone optimization. We went deep into this in week 5. So let me summarize the key points and show you how some of these peptides are stacked. Remember there were secretagogues? That's the ones that signal to your pituitary gland to produce your own growth hormone. They don't add growth hormone from the outside. People will use injections for replacing. This is stimulating your own bodies, your body stays in control. And then the CJC 1295, specifically without DAC, is generally preferred because it mimics the body's natural growth hormone, pulsing it rather than creating that constant elevated level. It's the foundation of most growth hormone protocols. Ipamorelin triggers growth hormone release through the ghrelin receptor, but without significantly affecting appetite or cortisol levels. That clean profile is why it is the most commonly paired peptide with CJC 1295. Tesamorelin is specifically recognized for reducing visceral adipose tissue, that belly fat. It's one of the few peptides in this category that actually has FDA approval for a specific clinical use. And Samorelin is a milder option, shorter half-life, more frequent dosing, but a longer track record of clinical use and a lower side effect profile. This is good for patients seeking vitality and lean muscle support without a more aggressive protocol. The stacks here are goal dependent. For performance and longevity, CJC 1295 plus ipamorelin. This is the gold standard. It's typically administered at bedtime so that it aligns with your body's natural circadian rhythm of growth hormone release at night. That timing really matters because growth hormone pulses are the strongest during deep sleep. So you're working with your body's biology, not against it. For aggressive fat loss, Tesamorelin plus ipamorelin. This combination specifically targets visceral fat while maintaining growth hormone pulse support. You can refer back to these last week's videos for the deep dive of CJC and ipamorelin and more. The third category that we went through was cellular energy. These are what some researchers are referring to the mitochondrial mimetics. They improve how your cells produce energy and produce fuel. SS31, also known as Peptide, this peptide acts at the mitochondrial membrane. Think of it as the membrane protection, and it may even help reduce oxidative stress and improve ATP efficiency, which is our energy in our cells. When your mitochondria produce ATP more efficiently, you feel different, you feel better, you have more energy. This is my top consideration for patients with chronic unexplained fatigue. Then there's also MOTS-C. This is sometimes described as an exercise mimetic. It activates some of the same metabolic pathways as exercise does. It's being studied for its potential in improving insulin sensitivity and fat metabolism. For people who have plateaued in weight loss despite doing everything right, MOTS-C is part of that conversation. For patients whose primary goal is aggressive fat loss with energy support, Tesamorelin, ipamorelin, and MOTS-C together. This combination targets fat oxidation from multiple angles while supporting energy levels. You're also addressing that visceral fat, growth hormone, and the mitochondrial efficiency all at once. In my week 4 peptide series, I mentioned a fatigued patient story where she just didn't need another cup of coffee. She said she needed someone to really actually just look at what was going on, why she was so fatigued. And the fourth category that I went into is called neuropeptides. These are the peptides that can cross that blood-brain barrier to support cognitive function and focus and be neuroprotective. One is called Cmax. It's a synthetic peptide based on the ACTH fragment. It's being studied for its ability to support BDNF, that brain-derived neurotrophic factor, which is essentially the fertilizer for our neurons in our brains. Research suggests it may support focus, memory, and the neuroprotective pathways. It's typically administered as a nasal spray. And the other one is called C-Lank. It's a synthetic tungsten analog. Where Cmax leans more towards focus and cognitive performance, C-Lank is being studied for anxiolytic properties, which is anxiety reduction, and neurotransmitter regulation. It's also a nasal spray. The two are often discussed together because they complement different aspects for brain health. I discuss both of these in the context of my Bredesen certified protocol, the RECODE approach for cognitive decline. The important thing to understand is that brain fog, memory issues, and cognitive decline are not inevitable. They're signals. These peptides are part of a broader conversation about protecting your brain, not just accepting the decline. And I also have to include gut repair because if you've been following my channel, that gut health runs through almost everything I do. For gut repair, the combination I discuss most frequently is BPC 157 with the KPV and maybe PEA and the GHK-Cu. BPC 157 supports the gut lining repair. Remember, it's naturally connected to those gastric proteins. KPV is an anti-inflammatory peptide that may help calm immune activation in the gut. and the GHKCU supports the tissue remodeling process. This is the stack that I used with Sarah in week 2. The oral BPC 157 with KPV before moving to the injectable BPC 157. And for patients with leaky gut, that chronic gut inflammation or gut issues that haven't responded to diet and lifestyle changes alone, this combination is part of that conversation. And this connects directly to my gut health content. You haven't seen my leaky gut videos? I'll link them in the description. Because peptides for gut repair work best when the foundational gut work, such as diet, removing irritants, supporting the microbiome, is already in place. Now, regardless of which peptides I use or that are stacked and what are appropriate for given patients, there are rules that apply across the board, and these really matter, and timing really matters. Growth hormone peptides are most effective when administered before bed on an empty stomach. You're aligning your body's natural circadian growth hormone release and working with your biology, not against it. And cycling matters. Most protocols involve cycling, which means 5 days on, 2 days off, or 3 months on, followed by a break, like 1 month off, to maintain that receptor sensitivity, because your body will start adapting, and if you never take a break from it, the signal weakens over time. Foundation matters most. I say this every week, and I'll say it again. Peptides are tools. They are not magic, and they work best when combined with proper sleep, adequate protein, resistance training, stress management, and addressing underlying issues like hormone decline or gut dysfunction or those environmental exposures. And medical supervision is non-negotiable. These are not supplements you order online. They require proper evaluation from proper sourced licensed compounding pharmacies, proper dosing, and ongoing monitoring. These peptides are being sold on the internet without a prescription and are not regulated and not tested and are not safe most times. Don't let your first symptom be your last, and don't let the convenience replace safety. If you're watching this and feeling like it's a lot of information, you're right. It is, and it's actually, that's what I'm actually trying to get to this point, because this is why you don't do this alone. This is why you work with a physician who understands the full landscape. Not just one peptide, not just one symptom, but how everything connects. Hormones affect gut, affects brain affects sleep affects growth hormone affects body composition affects metabolic health. It's all connected, and the peptide or the stack that's right for you depends on where in the web of your body that needs the most support, and that's what we got to figure out. That's why we do a deep evaluation, and that's the work, and that's what I do. Next week is the final episode of my peptide series, and it's the one I think that matters the most. We're going to answer the question I've gotten in the comments every single week, and we're going to find out who is actually a candidate for peptide therapy. I'm going to walk you through the exact framework I use to determine who benefits and who doesn't, and what needs to happen before peptides are even on the table. Subscribe so you don't miss it. If you've missed any of my earlier weeks, the full playlist is right here. And if you want to start finding out where you stand right now, take my free assessment. The link is in the description. It takes only a few minutes, and it's the same starting point I use with every patient. Everything I do, every protocol, every patient, every video runs through my one belief. I'm Dr. Myra Reed. I'm helping you to live smarter, stronger, longer. Don't let your first symptom be your last.